Okay. I sent out an email yesterday. If you didn't get the email, which was for the entire class, you, you don't use your email. That's unlikely in any generation. Okay. Or it went to your school address because that's all I had yesterday. Uh, and you don't read your school email. And so you don't know what's going on. Well, we need you to know what's going on all the time. So if you're going to use your school email and check it, you're already in business. But if not, I need to know the email that you would like me to send it to. And what I did yesterday is send out a little note that said, please reply. And I will capture your email address that you're wishing to use. Okay, there are 36 people in the course, and I got 18 responses. That means to me, 18 people don't know what the heck's going on. And I need to be able to get to all of you at once sometimes. This isn't going to happen. This isn't going to happen that I'm going to be sick one day. I haven't been sick or haven't missed a class ever. Okay. Uh, and I don't have to worry about even having a contagious disease because look at us, we're not even wearing masks online. Okay, so I'm not going to get sick, but what if I get in a car accident or something like that and I can't make it to class? I can't make it to the computer. Okay, well, I can have somebody do it for me right here. And they would send out the email and it would go to every single one of you, and would say in a sentence that I would have the person type that class is not going to be held today, and then you would know. Okay, not likely that I'm going to have a car accident either. I haven't had one of those. I can't say I haven't had one. I haven't had one of those in 20 or 30 years. Before that, they were pretty regular. Okay, so I need your email address. I'm going to send out this weekend the number that I'm assigning you uh, at random. And it'll be a number, however, between 1 and 36. 36 people in the class. But you won't know what your number is until I email it to you using the address you've provided. If you do not provide an alternative address, I'll be sending it to your school address. What are you going to use that number for? And you're not going to tell anybody else what it is. You're going to use it to see your grades. You're not going to use Canvas to see your grade. I talked to you about that the other day. Uh, but I post your grades. I send them. I let you see everybody's grade, but not their name. And you look at your number. Say I assigned you number 2. You look at student number 2. That's you for all semester. Any extra credit that you have. How many times I have you down for attending our Zoom conference Zoom. Um, everything will be right there, and everything is by your number. And I got to get you your number. So I need the email preference for all the rest of you who haven't given it to me. Okay, and it makes things a lot easier during an examination. Once in a while, somebody emails me from their computer while they're taking the test and said, "Hey, question 27. That's not right. That didn't come out right." And I'll take a quick look and, oh, damn it, it isn't right. So what do? I email everybody instantly during the test, and they'll see it pop up and tell them, just ignore question 27. I'm giving everybody credit for it. Okay? They'll get credit for it anyway, even if they don't see it. They'll just have to make a choice and think it's a bad choice, and then realize later on that I took care of it. I'll always take care of a bad question. And you would think, oh, after all these years, there shouldn't be any bad questions. There are bad questions. There always are a couple. One two questions that could have been worded a little bit better. Okay. Anybody not able to email me that hasn't already? Sure, no one. Okay. I'll send out another little blurb asking for that email address from you. I don't give it away to anybody. However, most of the class doesn't seem to mind me sharing their email address and just punching my address book rather than putting in everybody as a blind carbon copy. That takes forever. I sometimes can't wait forever. I need to get you some information right away while we're taking a test or something else. Okay. For your benefit, it's for my benefit too, because it makes it a lot easier for me. Any comments, questions?
Would you like us to reply to that email with the email that we would, because I would prefer using my personal email, or should I send you a reply from my personal email
I don't care
to
which
your email?
email account you use, except that I want it to be the account that you will read. In other words, if I'm trying to get a hold of you, should I send it to school and wait for you to check your school email? Or do you have your school email forwarded to your home? That either way, that works. I use that method. But if you want it,
So should I reply from my school email with my personal email so you could use that? Or would it be easier for you if I
no,
reply
I want the
to you?
reply to come from the phone you're actually going to want to receive the email. Does that
Okay.
make sense?
Yeah.
Okay. So don't use another phone and then tell me, I don't want this phone. I want some other one there. Wait till you get to the phone that you actually want, and then send me the reply. And it'll be taken care of. This is small potatoes, as they call it. This we should get over with in an instant and move on. Okay. But I'm still open for any questions about that topic or any other topic still that you've got. You know, it's only the first week of class, but by next week, we can't be saying that. We've got to get moving and not coordinating. Okay. So, what do you got to ask me? I'm looking at people, and I mean, of the 36 people, I've got 50, 16 people, not quite half, that are not black placards with white letters. uh, I like to see more faces, at least temporarily, sometime, maybe during this upfront time, and then you can black out if you want. You can black out if you want anyway. Some people are terribly shy, but I have to show myself, so uh, uh, I would like to see some people. But the comment I was thinking of, the people I'm looking at are mostly the people who email me. Okay? I get a lot. I get a lot of emails from. Oh, I'm not going to point at names, but I get a lot of emails out of this group. Okay? And the other group, I get emails that say, "Can I join the class?" And then they join the class, and I never see them again. But here, they're here. They're here. Okay. Think of one more question. Think of one more question for me.
I have a question, Charlie.
Thank you.
Under the assignment objective for the first week's assignment, it says just to know all of the bones of the skull and their markings. We don't turn anything in for that, right? You just want us to know that.
Okay, you're learning the bones right now, and you're learning the markings. Markings are also structures. For instance, the mastoid process behind your ear is a marking of the temporal bone. Okay, what I want is not to turn anything in. No,
Okay.
I want you to be able to identify those bones and markings on the practicum number 1 next Thursday.
Okay.
Because that's the only time they're going to count.
Okay. Thank you.
Okay. Great. I don't think you've had enough time yet, with 2 days behind you, to be dreaming about bones. But it's going to happen. Next week, you'll start dreaming about bones. We're going to finish the vertebral column today, or start and finish. And then tomorrow, I'll do the upper appendicular skeleton with you. Then on Monday, the lower appendicular skeleton, and continue on Monday with the bone box. Okay, I'll back up to the skull and start showing you the actual bones and try to hold them up to you. It's a little difficult on the screen, but especially for the skull because it's got so many small parts. Tuesday, for lab, I'm going to go over the bones again, either as a review for you or show you more of the skeletal bones that you haven't seen before. Wednesday, the same thing. You're going to have a lot of review time. Okay. And there's a lecture on each of those days that you have not had, but you will have a lot of review time in the lab and a lot of questions, I know, as we move closer and closer to the practicum, which will be your easiest test. And dang it, it's going to be your highest scoring test. Okay, we're expecting about a 98% out of the class. Who doesn't believe that we can get to 98% yet? You got a hand down or a raise?
Charlie, we're bringing 100 across the board.
Oh, okay. that would be great, but there's no extra credit on this test. Okay, the extra credit you're getting right now, sitting there, okay, today, and you want to keep that extra credit, so you're going to have to turn in those guides. By the way, let me see. Laura, are you here? Well, then I'll have to get a hold of her by email. Okay. Please submit your study guides. Never said this before, but I would prefer they either just be a Word document or even better, a PDF, portable data format. Okay. Please don't send them to me as Google Docs. Don't send me them as Microsoft this or that doc. Don't send me them as an iCloud document or something like that. Some of these things, uh, yeah, they all open up if you've got the right program, but I don't have every single program. I've got most of them. Laura, who I mentioned a moment ago, sent me hers already yesterday. I can't open it. I have searched everywhere. I don't use iPhone. I don't use Apple. I don't use Macintosh. Okay, I'm straight PC all the way, and I've never had any trouble reading anything until yesterday. So I have to ask her to convert it and send it back again. That's not going to be a problem for her, but it saves time if I can have either a Word document or a PDF. If you want to experiment with some other program, you're still welcome to, but expect that I might send it back to you. Okay. Okay. Let's get started here. Yesterday, I was able to just tap on this share button. I don't think you can see it yet. Can you see my needle?
Yes.
Yes.
You can, in the center. Well, that's nice, except I don't want to be on this page. I'm still going to have to go through the login. Okay, you see me at week 1?
Yes.
Yeah.
Okay, thank you for responding. I know it's kind of embarrassing, especially if you're the one that finally gets elected to do all the yeses and nos. Yeah, but it's really helpful. I have gone through an entire lecture, and then somebody said we couldn't see anything. Thanks. Tell me right up front. Okay, if that happens. Okay, uh, here's the website, Charlie's website I showed you. It's at the top of week 1, and we're on the 3rd day of that week. If I click on it, it doesn't pop up for me. Uh, it's an external URL, so just click the title, and back it comes. And under, oh, reading assignments, none yet. Well, that's just as well, because I'm going to review that tonight, and that allows me to personalize it for us. Okay. Don't forget under web links for Unit 1 that you have 3 links that I still consider good. I got rid of the other ones. These links to external sites still work. They show the bone boxes. This one's taking a while to come up, but it's here. 3 links. Go to the link itself, press Control. It turns the cursor into a hand, and you can click on it. This says that there's something suspicious or whatever about this. Maybe. The maybe is what counts. There's nothing bad. You're not going to put malware. And here you go with the bone box, as it's called. These are good tools. I have a bone box that looks just like this, and that's what I'll be bringing out to you. Okay. It's always better to do the bone box after we do the diagrams in the book, because the diagrams in the book will hold still, and the bones won't hold still while Charlie is here twisting them around, trying to figure right from left because everything is backwards on my screen. Okay, so I'm going to back out of that one by getting rid of the tab, get rid of the tab. I'm back into Canvas. So now I'll take the arrow. Okay, we did the intro lecture and some bones on Monday, and we used a piece of paper, a chart that coordinated the bones with the figure locations in the book. And then we did the bones of the skull, the first portion, and then I posted a recording that night. Okay. The joints were done yesterday, and then we had bones and structures of the skull, the second part. And then last night I posted the recording for you. Okay. I also put in a practice quiz. I told you about this. If you got my email, you know about it. If you've been reading your email and you don't know about it, I don't have your email address, the one that you would really like to use. So please send it to me. This practice quiz is for the lecture, really, because it doesn't have any images if I open it up. And this thing is always available. There's no time limit. There's no points. A practice quiz is exactly that, to help you out. So here are the questions. You simply pick the correct answer or the most correct answer. And when you're finished down at the bottom, hit the submit button. If you want to take the quiz again because you didn't do so well, I would first study. Some people immediately take the quiz again, focusing only on the things that they miss. And it's almost like a guessing game until they get them all right. That's not the way to do it. Take the quiz, see where you stand, go back and study, and maybe take it again the next day or the next day after that. Okay. But do take it until you finally do get it all correct. Okay. There'll be another practice quiz inserted in here before you have everything ready for you for next week. This was the perfect spot for a practice quiz because it only did the lecture material for the first 2 days. Today's lecture period is going to be devoted to ossification. This is not a long topic. Ossification is the formation of bone. Okay. It's a gradual transition from a fibrous or a cartilaginous template to bone. Anybody know what a template is? Want to try?
It's like a guide for something
Yes,
that you follow?
exactly. It's a guide. Okay. And it can be made out of cardboard. Ever have a cardboard stencil and then you took a pencil and outlined the letters of the alphabet in different scripts? Sure you did when you were a kid. Okay. Uh, that's a template. Okay. Another sort of a template would be if you're into art. You do an underpainting, a painting that is rough, and then you cover it with the real painting. So you're using it as a guide. Or you can build a plastic figure human, okay, and then add to that material that imitates skin, hair, eyes, and everything else. But you use the template to start with. Okay. Uh, when we're first conceived, egg and sperm coming together to form an embryo, we don't have any bones, but we grow and bone templates begin to form. These are not bone yet. They increase in size, and when you're born, they're not fully developed bones yet. If they were, it would really hurt your mother. Uh, so you eventually grow anyway in stature from the size of a newborn to your full height, and your bones gradually uh, complete their development. Okay, so they work on a cartilage template too. You'll see that in just a second. Okay, ossification is the gradual formation of bone. There are 2 types: intermembranous ossification, and when we get to it in a moment, endochondral ossification. Intermembranous ossification, and this is kind of boring text for a second, is the least common or lesser common of the 2 types of ossification. I'm looking at this and I see a spelling error on my part. This should be intermembranous ossification. Okay, I changed a couple things as I promised last night, and I'm almost finding some things. My keyboard is terrible. I got to get another one, but I just spent $100 on this damn thing, and all it wants to do is keep repeating the letters over and over again, and it's a monster to use. I'll get myself a better one. Doesn't hurt you anyway. Okay. Intermembranous ossification. This is usually used at the formation of what we call flat bones. We don't have a lot of flat bones in the body. Think, however, of your sternum, your breastbone. That is pretty dang flat. Okay. How about your parietal bones, the two at the back of your skull? Now, if you pull them apart, if you could, they're almost like parts of a coconut, and nobody would really call them flat, but anatomists do. Even though they're curved, they're thin in comparison, uh, and we call those flat bones. How about the temporal bone? The temporal bone above your ears, okay, in front of your ears, that's the squamous portion, and it's flat. The petrous portion of the uh, temporal bone, or the rocky portion, is not flat. So here we've got a bone right away, the temporal, that is part flat or squamous and part irregular or rocky. The flat portion of the bone is formed from intermembranous ossification. Okay. Think for just a second. When you went to school and possibly, well, my mother would make me a sandwich, put in a bag. I don't know if it's still the case. Maybe these days you just send the kid to school with money. Uh, I don't know, but I know you can imagine this. Take two pieces of bread, okay? Just two pieces of regular, right out of the package, white bread is standard here. And so you got two pieces of bread stacked on top of each other. That's not a sandwich. Something's got to go in between the pieces of bread. That'll make the sandwich. What kind of sandwich do you think I'm talking about? What can I make?
Ham and cheese, lettuce.
Peanut butter and jelly.
Okay. Uh, when I was a kid, we didn't have much money, and so I got oleo. We called it oleo. It's oleo margarine. Today they call it. I can't believe it's not butter, and it's not butter. But we would have oleo margarine. After World War II, it was rationed out, and you received the oleo margarine stick, and it was white. The margarine was white, and you also got a pill, which had a fluid inside, and you mixed in a bowl the fluid and the margarine. The fluid turned the margarine yellow, and that's what we had. So I would get some margarine on one of the pieces of bread. Sometimes, if I'm lucky, on both pieces of bread put together, and that was it. That was the sandwich. Well, I graduated upwards from there, and my mother started putting sugar, a teaspoon of sugar in the sandwich. So it was sugar butter, I called it, or sugar margarine. And yeah, I like that kind of sandwich. But then it became a jelly sandwich. Margarine and Welch's grape jelly, a little bit, push the two pieces of bread together, and that was your sandwich. That was my least favorite. And of course, peanut butter and jelly was always my favorite. Okay. You can buy uh, jelly these days in a tube. Okay, like toothpaste. You can buy the peanut butter in a tube, like toothpaste. So imagine that we have those two things on the table, and we've got the two pieces of bread. I'm going to take the uh, peanut butter first, and I'm going to stick the tip of the tube in between the two pieces of bread and squirt it in there. That's intermembranous. The membranes are the bread themselves. Okay. Then I'll put the tube of jelly in and squirt some of that in. Of course, it's not going to come out very neat in my example here, But the idea that I'm trying to get across is the sandwich or bone is being built between two membranes. Okay, these, of course, are starchy membranes, being two pieces of bread. But they're fibrous membranes in the body, and you might have two of them with a space in between. Blood brings calcium and phosphorus and other minerals that solidify into bone in between the membranes. Okay, the membranes are rather flat, parallel to each other, and you end up with a flat bone. Another example, do you remember water beds?
Yes.
Yes.
Fortunately.
Yeah, how many of you, well, I can't, I'm looking at my own screen here, so I can't see your, yeah, I can see your reply. How many of you slept on a water bed at some time? Just use your hand marker to the emoticon if you did, or you do it that way. How many of you slept on a water bed last night? Nobody wants to sleep on those damn things. Oh, I slept on one for a year or so. Patricia, you slept on a water bed last night?
No, not last night, but I did have one for a number of years back in the 90s.
Oh God.
I know.
I think
Remember the
that's an
tube ones? We didn't have a bladder. There were like several tubes.
okay. I didn't like them mainly because my nightshirt would, when you roll around in the bed, your nightshirt might come up and your back is exposed, and the sheet might come off the water bed, and your back touches the vinyl, and it sticks like a band-aid. You have to peel yourself out of the bed in the morning. It's not a very pleasant experience, I don't think. But if you think of a water bed or imagine one, even if you've never actually touched or seen one, it's got an upper half and a lower half, and the seam comes together. There is a spout, an entrance, where you screw in your garden hose and you can turn it on and fill your water bed from the inside. That's intermembranous ossification. You've got two fibrous membranes, and then you've got the delivery, and in the human body, that's blood of calcium and phosphorus. And they will solidify to form bone. The type of bone they form is called cancellous bone, also known as spongy bone, which I'm going to show you in the next picture. And I'll get rid of you guys for a second. Okay. The bottom picture is the most telling. Okay. Here's the bone that has been formed. This is the peanut butter and jelly. This is the bread. This is the bread. The bone is called spongy bone, or also known as cancellous bone. Here's the word right over here. It's porous, quite porous. It's porous here. It doesn't have a regular symmetry to it. You don't have a bone box with you, but in some of the pictures that we'll see later of a cranium that's been sawed, so we can see the thickness of the parietal bone, you'll be able to see the small cavities that are in the parietal bone, indicating it was formed from intermembranous ossification. Here's a couple of locations where we have flat bones. If you can't tell, that's a head of an infant. Here's the flat bone of the skull. Well, what bone is that? That's the temporal bone. And it's only the squamous portion of the temporal bone. Here the posterior part of the occipital bone is formed from this type of ossification. And part of the mandible, the body of the mandible, is formed from this type of ossification. Ossification, formation of bone, cannot take place without the presence of bone-forming cells called osteoblasts and blood. We've got to have all of those things present. Cartilage itself does not have a blood supply. So the blood's going to have to invade the cartilage and form the bone inside the cartilage. And you'll see that in a moment. You have to take a little bit on faith for now. Okay, again, spongy bone, same thing as cancellous bone. Are there any other flat bones in the body? Well, under your eyes, that portion of your maxilla is flat. You remember in the back of the eye, the lateral back of the eye, the plate from the sphenoid bone that we touched yesterday. It's flat. That's flat bone. The sphenoid bone, as it is lateral and outside of the skull, or on the outside of the skull, is flat. The frontal bone, your forehead, is flat. Okay. Now you may say it's curved, but it's still considered a flat bone. Here's the other type of ossification. This is endochondral ossification. It's the most common type. A cartilage template, a model made of cartilage, is surrounded by a fibrous membrane that's called the perichondrium. The word para means around. Con, we said the other day, means cartilage. Okay, so if you can imagine just for a second, and I'm not going to leave you imagining everything, don't worry. If you imagine an x-ray of a fetus, we usually don't take x-rays of fetal development because of the risk to the fetus, but there are times when it's necessary. We can see a little arm. We see the upper arm, and it's a little piece of, or sliver of cartilage. And then we see two slivers coming out in the lower arm for the radius and the ulna. Okay, and these are the cartilage template. As the template of cartilage begins to grow, ossification begins in the central part of the template. I've got a nice diagram for you to get that across. Okay, that central part of the template is called the diaphysis, which is the central part of the bone. Grab your upper arm right in the middle with the other hand. Just grab it. Don't grab it down at the elbow. Don't grab it up at the shoulder. Grab it right in the middle. And that's the diaphysis of your bone. And that refers to the shape of a long bone. Your humerus is a long bone. With your hand in the same place, grab the diaphysis again, and this time go down to the end of the bone, the distal end at the elbow, and then up to the shoulder where you can feel it sort of disappear. Those two ends are called epiphyses. Diaphysis is the shaft of the bone. Epiphyses are the proximal and the distal ends of the bone. We're never going to understand this if we don't have a picture. So,
Charlie?
yes.
Do these terms only apply to the long bones? Diaphysis and epiphyses?
Yes.
Okay. Thank you.
Okay. Once the template begins to grow, it can only do so if it's got a blood supply. So you're going to have a capillary, at least, a vessel at best, enter into the cartilage template, get to the center of it, bring bone forming cells, bring nutrients, and then cause growth. When it's only a cartilage template, the bone is surrounded by the perichondrium, as we just said. But once the bone starts to actually grow and have osseous tissue in it, it's said to be surrounded by the periosteum around the bone. Well, dang it, the perichondrium is a fibrous coating. The periosteum is a coating. One surrounds cartilage, the other surrounds growing bone. They actually are the same thing. It's just in time. So at one point in time, you were a kid, and now you're an adult. Or you were a teenager, and now you're probably not. I think one person in the class is still. Okay. Okay, so we'll see this again in just a second. I'll come back to this epiphyseal plate. Okay, here's endochondral ossification made clearer to you. With an x-ray, we'd only be able to see this. A small cartilage template, being called a model here, but it's the same thing. Cartilage, model, cartilage template. It is surrounded by the perichondrium. Okay. Think for just a second of a sock, a foot sock. Take this cartilage piece and slip it into a sock and bring the sock up all the way around it and tie it shut. That sock is your perichondrium. Okay. It's a fibrous connective tissue that helps to hold everything together. Of course, we don't have wool in the human body. No one would want to wear wool socks anyway. Now, this next stage has evolved from the first one, and only because blood vessels have gotten inside and they enter in the center portion. Now, remember, the center portion is also known as the diaphysis. Okay. I don't see that label here, but I'll be pointing it out in all of the pictures. This is the diaphysis. Okay. And the bone begins to enlarge and form. Well, when that happens, your sock is still there. Well, it's a stretch sock. Okay, so that's good. So it can get larger, but it's now called the periosteum. Okay, periosteum. The first bone that forms in the center, in the diaphysis again. And since this is the first area of bone formation, it is called the primary ossification center. Blood vessels have penetrated. Without that happening, none of this would go on. Compact bone is developing here and here. And in the center, it's a loose formation of bone called the cancellous bone or spongy bone that is being formed. This is the diaphysis, and the ends here and here are the epiphyses. We'll have this down by the time we get across this page. Move on, everything's enlarging. We have a medullary cavity. Come back to that. Surrounded by compact bone here. And that comes around to here. Bone formation now picks up in the epiphyses. Here, here, and down here. Since these came along after the primary ossification center, the secondary ossification centers are now being formed. The primary ossification center in the middle is not attached directly to the secondary ossification center. There is a joint in between them called the epiphyseal plate. We can see the epiphyseal plate over here, and we find it over here. The epiphyseal plate was one of the examples of a joint that I mentioned yesterday. Does anybody want to make a guess as to what kind of joint? It's not a suture, for instance. What was it? Then look in your notes if you've got them. Or maybe you can't because they're on the computer right now and I've hogged your computer.
Was it the
Is it
cartilaginous joint?
Well, that was mumbo jumbo, they call it. Okay, I didn't catch that. Say it again.
synchondrosis?
It is a synchondrosis, exactly. This is a synchondrosis. The best example is an epiphyseal plate. Now, this is going to sound a little big brotherish or stern or whatever, but it's got to be said. You should have known synchondrosis already. You're not going to have time to go back to these lectures and learn them on the night of the examination and think that you're going to do well. You've got to go and re-examine the lecture, as simple as it might be or as hard as it might be. Re-examine the lecture, I would suggest, the same day, in the evening. How long does it take? Not really that long. But you need to learn this material as we go along, and please don't let it accumulate. Okay? The lecture tests, sometimes they're deceptive. It looks like it's going to be easy sailing, and it's not. That's where the grades are made or broken. Okay? So please take my advice, if you will, anyway, and keep up. You're going to be reviewing this anyway to get ready for any test. Best time to review it is right now, or as soon as we're finished. Okay, now this medullary cavity, okay, that's the resting site of all the bone forming cells. And your white blood cells, your red blood cells, your platelets, they're all formed in these long bones in the medullary cavities. You've all seen this. You've all walked along, and somewhere in your life, and unless you've been terribly sheltered, you look down on the ground and there's a bone. There's a bone. Looks like from a meat market or something. The bone is tubular. You can stick your little finger in, partway at least, and what you're sticking your little finger in is the medullary cavity. Once it's devoid of any material after it's dried out. You ever give a dog a bone? Yeah. Okay, that's always fun to watch them. And then later on, you wonder, where did you put that bone? Where did you put that bone? It's going to stink and show up somewhere. Okay, then you wish you hadn't. Okay, this is the medullary cavity. Okay. This up here is the epiphyseal plate. And you can see by looking ahead that we're going to form a femur. the epiphyseal plate becomes remnants of epiphyseal plates down here as well. As you mature, the epiphyseal plate, this enchondrosis, disappears, and the primary and secondary ossification centers unite. This is spongy bone in here. This is bone that has a lot of compartments in it. Some people call them bubbles, okay, but it's quite strong. And the compact bone is located here and going all the way around. So if you think of the bone I just mentioned that you put your little finger into at least part way, the shaft, the diaphysis, is compact bone. Here's the diaphysis, and up at the top, the epiphysis, If you want to be precise, this is the proximal epiphysis. This is the distal epiphysis. So what we've done here is ended up with a mature bone. Doesn't have the epiphyseal plate anymore. The compact bone is solid. The bone has reached its ultimate length. The epiphyses can also be capped by an area of cartilage right down here. This is articular cartilage. Articular cartilage is also formed from hyaline cartilage. We'll see what that looks like in just a moment. Okay. In compact bone only, that's that hard diaphysis, that circular bone, we have what's called Haversian systems. Okay. Haversian system, it was named after a guy named Haver, who developed the idea of the Haversian system to begin with. There's a move these days on to get rid of people's names. I don't like that, but it's going to happen anyway. But for us, still, it's called the Haversian system, and it only exists in compact bone, not the spongy bone. Okay, here's a bone that you picked up off the ground. It's got a hole in the center, but before it got that hole in the center, it was filled with blood and also some of the caverns of spongy bone. Here's spongy bone, also known as cancellous bone, right in here. This area outside, making a circular run all the way around, is your compact bone. Down to here, cut it here, then up. This is compact bone. Only compact bone has the Haversian system, which is also known as an osteon. Here's an osteon. As if we could take one of these circular regions that I'm pointing to and lift it out like a telescope, lengthen it. This is the osteon. I like this diagram not because it's clear, it's not all that clear. I like it because it shows you the osteon being rounded or cylindrical here, sits inside of the compact bone, which is also cylindrical. And I want you to see that so that you don't get confused. Now the terms lamella, caniculi, they don't show up well here, but they do in my next picture. And then we can come back to this one. This is showing an osteon over here. Well, this is a better osteon being pulled up. The bone is surrounded still by a fibrous membrane, and since it is bone, it'll be surrounded by the periosteum. Okay, here's a model that we use in the classroom. This is an osteon. This is not all of the compact bone. This is just one piece coming up. In the very center, we have blood flow. And in the center, this is the Haversian canal. Most people don't think of blood flowing through their bones. They don't feel it, they don't sense it. It's happening all of the time. Most people think that their bones, when they're mature, are going to stay there. That's not true either. Your bones are being broken down and reformed all of the time. In 11 years, it's calculated, every bone in your body will have disappeared and been replaced by new bone. Okay. And first time I heard that, I sort of cringed too. Okay, in the osteon, when it's formed, it is layered, okay, on the outside. Now these layers are artificially colored on the model, so they alternate colors. But they're all called lamella. So this is a lamella, or layer. Between two lamella is a small cavity. This is a lacuna. Many, many lacunas. This is like a small crypt. Okay, it doesn't flow to anywhere. And what sits inside of the lacuna is a bone forming cell right here, the osteocyte bone cell. I haven't indicated whether this is a bone building cell or a bone destroying cell. It could be either, but looking at it, you can't tell. You can't tell just by looking at it. So we, in this class, will just call this an osteocyte. The osteocytes receive nutrients and expel material through these small blood channels called canaliculi. Canal or canal iculi. Now, whereas the Haversian canal goes up and down the compact bone, here's the Haversian canal. We also have Haversian canal interconnections to an adjacent osteon right here. They go sideways. These are Volkmann canals. Yes, named after Volkmann. I don't know who he was either, but he got to it before everybody else. So what we're saying here is that the movement of blood, oxygen, and nutrients is universal throughout the compact bone. On the practicum, please know all of these and know that this is an osteon. This picture, this exact picture will be on the practicum. Once in a while, I'll tell you things like that. Yeah, I can't tell you everything. Okay. Okay, it's 2:04. Let me give you a break if I can to 2:15. If you have a question, you can stay behind and ask it. Okay, I'll see you in about 10 minutes or so. Okay. Back. Yeah, I can see the lights coming on. Okay. Anybody think of a question? No, that's not what you took a break for. Okay. Okay. Even though I can't see everybody now, I eventually will. And by that, I mean, I'll probably see you out in society. I see so many of the nursing students, uh, uh, no matter what position they're filling, that hang around Orange County. Uh, you know, I just see them all over the place. Well, with all the different years and all the different classes I've had, I don't remember everyone. If I remember you, it's probably not a good idea. Uh, uh, it's probably not because you were the ideal student. But I do see you when I'm out there. When I was 48, 48, that was some time ago. Most of you haven't reached that. I think a couple have. When I was 48, I had a heart attack, and I denied it. I denied that I was having one, just like everybody else would. And I finally got somebody to drive me over to Mission Hospital. And I go in there, the emergency room. It wasn't too crowded in those days. And this guy sits me down, is taking my blood pressure, and he goes, "How's it going, Charlie?" And I said, "I wouldn't be if it was going good. I wouldn't be sitting here." Uh, and he said, "Yeah, that's probably right." So then I went into the emergency room itself. Of course, they did some tests to determine whether it was truly a heart attack. It was, and I don't know why they do an X-ray, but I guess possibly to see if there was any bone damage or something else to be uh, considered. So they were wheeling me in a wheelchair, of course, down to the X-ray area or room, and I hear behind me heavy, heavy running footsteps. I mean, who was ever running towards me from behind is a big person, and he gets up there and he's going, "Charlie, Charlie, is that you? Is that you, Charlie?" And it's one of my students. And I said, "Yeah, yeah." Uh, and he goes, I was expecting him to say something different, but he said, "How did I do on my test today? How did I do on my test?" And that was unexpected. When I left the hospital 3 days later with a stent, uh, he came up behind me again. I could tell those footsteps. And he says, "Charlie, did you grade my test yet? Did you grade my test? No, how are you or anything like that." It sort of got to me. But I knew I would see him. There's one person I saw. I was in the emergency room for Mission Hospital for somebody else. I took them there and stayed with them for a while. They were having an attack of an autoimmune disease you probably never heard of, NMO, neuromyelitis optica. Uh, interesting, uh, interesting disease. The person went blind, uh, and the hospital uh, uh, work managed to restore complete sight. and that was amazing. But it's a lifelong thing you have to watch out for. But I'm in there sitting with the person, the patient, and at the front desk or the nurse's desk station, it's a student of mine, and she's motioned me over, and we're talking and everything, and finally she stimulated enough of my memory that I could remember her. And once I do catch on to somebody, I can remember exactly where they were seated in the classroom. So we talked, and I'm back in the glassed-in the room with the patient, and going by in a gurney is, of course, a patient being pushed by, I'll just say the word nurse. Could may not have been the exact title. And the nurse looks in, pushing the gurney, and starts waving, saying, "Hi, Charlie. Hi, Charlie." And then the patient, she sits up out on the gurney, and she goes, "Hi, Charlie. Remember me? Remember me?" So I got a nurse and a patient both at the same time. And so I'll be seeing you guys in different places. About 3 months ago, I had a knee replacement. Uh, the easiest thing I have ever done. The doctor was absolutely excellent. No pain, uh, nothing. I was up and walking in 1 or 2 days, and completely. Uh, well, you had to go to rehab for a while, but that was the hardest part. But here's a knee replacement that was supposed to be so bad they loaded me up with pain pills, and I never took one. Just wasn't necessary. But they wheeled me in for the procedure, and this was down in Laguna Beach at Mission Hospital, and there are about 8 medical technicians, including the surgeons and anesthesiologists there, and I'm getting a spinal, and I told them I wanted to stay awake during the whole thing. Yeah, they didn't listen to me. But just as they're starting to do that, there's a voice in the room shouting out, "Hey, Charlie! This is Charlie. He's my very first instructor in my career." This person must have been from 20, 30 years ago. Oh, God. So uh, I would have said something, but they put me out. Okay. Oh, they did applaud. They did applaud uh, because I guess I had helped one of their own, or something like that. They did a good job. Okay,
How does that
now the
feel
power of
that
your
you did
back,
that?
huh?
How does that feel being an instructor and then seeing all these students years later?
It's unavoidable. It's just unavoidable. I I used to teach. I teach horticulture as well, and I used to be so antisocial. I go through phases, and I said, "You see me in the store, you see me in the supermarket, please don't say anything. Don't come up to me and say hi." And they do anyway. They do anyway, and they'll grab you and whatever. So that was mainly the horticulture students. One student in human anatomy, Frank, I don't remember his last name. It started with a T, but it's not important to you. Uh, Frank, I told him to stay after class for a little bit. I wanted to talk to him, and I did. And I said, "You need to drop this class." And he wasn't doing that badly, but it was getting worse. I said, "You need to drop this class because you have a drug problem, alcohol or drugs or both. You know, and I'm not going to talk to you about it, except to tell you you need to clean up your act or you'll never get through this program." And he was dumbfounded and left, and I never saw him again. He dropped the class. He dropped the class. Then I was in the medical tower. This is a new one, the Wellness Center, again at Mission. coming down the elevator, got to the first floor, and walking by the elevator door is Frank. Frank is a big guy. I didn't tell you that. He came in, waited for me to get out of the elevator, came up and gave me a bear hug, lifted me off the ground, and swung me around. And he said, "Thank you, thank you, thank you." You know, we did what you suggested, and he's now a registered nurse. So
You
that
probably
that one
saved his
felt good.
life.
Yeah, that one felt good.
Yeah, you totally saved his life. I
I
think
don't know about that.
if he was
Some,
on drugs and alcohol.
yeah, I never found out which it was. But there's really very few pure alcoholics any longer. If it's one, it's both. Okay, that was pre-opioid days. Okay, did anybody while I was uh, rattling on there come up with a question? Okay, you can always email me your questions, and a lot of you have taken that to heart. So we'll get back and finish this now for today, and then tomorrow. And we'll be starting. You'll feel the class starting to streamline uh, for you. Okay, share the screen. Can you see my cursor?
Yes.
Yeah.
Hey,
Yes.
found the shortcut. Thank God. If you ever enlarge your screen, you know the trick. Go up to where it says 180% in this case, click on it, and you're back to the right size. Okay, so we just did ossification. You need to read the book. I'm going to assign that chapter for you. I'm not going to assign so many chapters that it makes a big dent in your study time for the practicum. Okay, but you need to read that one. Okay, here's the bone and figures for 6-9. This is just on the vertebral column. Okay, and if you look at this, okay, you've seen this kind of thing before. Here's the list of the things that we're going to cover. We'll cover all of these right now. It won't take as long as it looks. And if you're using Marieb, the figure that corresponds to the article or the structure is listed right across from it. Okay. I suggested last night that you might want to copy this and have it available for yourself, since you won't be able to have access to your screen here. Okay. I've got a copy for myself, and that's just so that I can clue you in if you ask. Okay. A lot of these don't need that, however. Okay, so now where we're really at is 6-9, bones and structures, vertebral and ribs. Okay, this is a thoracic vertebra. No, it's not. Yes, it is. Yes, it is. This is the thoracic vertebra. The thoracic vertebra in profile looks sort of like a Davy Crockett coonskin cap. Okay, I think that all of you might know what I'm talking about, with the tail coming off the back and quite slanted. This is a typical vertebra. And in your study guide, the first thing we're to look at is a typical vertebra. Okay, the forward portion or anterior part is here, and it's called the body. The body is also over here. So this is a superior view, and this is a lateral view. Here's the body. Let's go to the other side. This is the spinous process. And the spinous process is that part here that, looking laterally, is sloped downward. If you can recall the time you saw somebody on a bicycle hunched over and shirtless, I'm sure you've seen somebody with a bunch of bumps on their back where the spinous processes are located. The person probably looked like a stegosaurus. Okay. You can feel your own if you don't have access to your own back, because it's kind of hard to reach sometimes. You probably have some family member that can show you the spinous processes. I know you actually have seen them already. Okay. This and this is a transverse process. The transverse process is located right here. And on the end of it, it has a facet. You do not need to call it the transverse costal facet, but just the facet. Now, here's where the benefit comes to copying that page I showed you. I can put notes to it, and it's kind of hard to put notes to this screen. You also have your pen and pencil to take notes, but I would go back if you did not copy the figure page, as I call it. Go back and do it, and a little bit later. Okay. The transverse process with the facet. A facet is a face. That makes sense. Facet, face, and it articulates with a rib. Okay. The ribs of the body will have their head here, spin around here, and be stabilized by the facet on the transverse process, and then go out into the rest of the body. The number of thoracic ribs is 12. Pairs of thoracic ribs is 12. And the number of thoracic vertebrae, as you see here, is 12. I'm looking at my sheet, and the next thing it asks for is the transverse foramen. And I don't have a transverse foramen. Why? Because the transverse foramen is unique to the first 7 vertebrae, which are the cervical vertebra, which we'll see in just a moment. We have cervical vertebra, 7. Thoracic vertebra, 12. Lumbar vertebra, 5. The sacrum counts as 1, unless we're talking about the nervous system, which we're not. Okay, so 1 for the sacrum and 1 for the coccyx. Total number, well, what does that come to? 7, 12 is 19, 24 with the lumbar, 25, 26 with the sacrum and the coccygeal vertebra. 26 vertebra. And they're all interconnected top to bottom with symphyses for sutures. Or not sutures, but for joints. Symphyses. Slightly movable cartilaginous joints. Okay, so I have to skip on my sheet the transverse foramen for a moment. And if you want to follow along, we're at figure 720. I might give you a second if you don't have your book out and you want to get it out. We're on figure 720. On figure 720, which should look just like this, look for the pedicle. Here's the pedicle right here. I call that 3 o'clock. And also a pedicle over here. at 9 o'clock as we look at this. Okay. The lamina is here between the spinous process and the transverse process. It's rather flat and it's wide on both sides of the spinous process, the lamina. The vertebral foramen is the easiest part. The spinal cord goes through it. This is the vertebral foramen right in the middle here, and we can't see it in profile. The spinal canal. This is an easy concept once you've got it, but until you do, it's murder. Okay, here's a vertebral foramen. A moment ago, I said we have 12 thoracic vertebrae and 26 vertebrae altogether. Stack another thoracic vertebra on top of this one. Imagine another one on top. We've got two vertebral foramina in a row, and then another one, and another one, and another one. Altogether, they make up the spinal canal. The spinal canal is not a property of any just one vertebra. It goes all the way through. The superior articular process is this right here. And it says antfacet, but we won't worry about that. This is the superior above, articular meaning joint. This is the inferior articular process. Obviously, they can't touch each other on the same thoracic vertebra. But if I took another thoracic vertebra in profile here, put it on top, the superior articular process would come into contact with the inferior articular process of the thoracic vertebra that I just added. They touch each other.
Do we need to know the vertebral arch?
No, where are you getting that?
Oh, I'm just looking at it in the book, figure 720, and then comparing it to the lab.
Okay. This is another reason why maybe you've done it, maybe not, doesn't matter. I want you to copy the vertebra, ribs, and sternum. I want you to copy that page and go back and do it for the skull, the locations, because that's the list that you'll be asked. And you'll see that vertebral arch isn't on
Isn't
this
on
list.
there? Okay, I just wanted to double check.
No, that's fine. I'm glad you did because now other people know.
Thank
You
you.
want those lists. That's all you're responsible for, but you are responsible for everything that is on the list. Nothing
Okay.
more.
Thank you.
Okay. Now I'm going down upstairs. These are cervical vertebrae. The cervical are underneath the skull, between the skull and the first thoracic vertebra. There are 7 of these. This is the cervical vertebra number 1. We abbreviate that C1. It's also known as the atlas because the skull fits on top of it, and atlas holds up the world. You remember yesterday the occipital condyles. Okay. Well, the occipital condyles, those 2 bumps on the underside of the occipital bone, sit here and here. This is the transverse process. Different look, transverse process. And it's not going to articulate with a rib coming out of your neck, but instead it's got a hole in it. These are foramina. These are the transverse foramen, or foramina if you want to talk plural. What runs through them are blood vessels and nerves and lymphatics. It's, the neck is quite exposed, but to give it a little bit of safeguard, the vessels, the main vessels, are often inside of these transverse foramina. They go down through all 7 cervical vertebrae. No other vertebra have transverse foramina in their transverse process. Now, another unique thing about C1, it does not have a body, which would be right here. The body here is missing here. Why? Because C2, cervical vertebra 2, known as the axis, goes here, goes under here, and pops up here. This one, the upper one, you have to superimpose in your mind on top of the lower one. The part that projects upwards into what would have been the body of C1 is called the dens. It's also called the odontoid process, but I don't have that on my sheet. I have only dens, and dens is the answer to the question if it ever gets asked, and it very likely will. Okay. Here's the transverse foramen that we can see. This one doesn't show as well. This is still the vertebral foramen here. This is still the spinous process. This is the lamina. And the pedicle is not distinguishable here. Let me go back up to this one. And bear with me and start at the spinous process. We'll call that 6 o'clock. Now, if your book has it displayed upside down, well, then you can call that 12 o'clock. But for our purposes, for right now, at 6 o'clock is the spinous process. At 7 is the lamina. At 8 is the transverse process. At 9 o'clock, the pedicle. And from 9 to 3, the body, and then the other pedicle. And at 4, the transverse process again. And at 5, the lamina again. Should be able to go all the way around. And of course, it's bilaterally symmetrical. Okay. Yes.
Question about this one. You mentioned that there were 2 unique things about the C1 vertebra. One was that it does not have a body. Was the other that it does not have the spinous process?
No, the other is that it has the transverse foramen. It's unique to the cervical vertebra. And if I indicated that it's only unique to C1, I would have been wrong. So maybe I was wrong. Okay. The 2 unique things about this vertebra are no body and the transverse foramen. Okay. This is a lumbar vertebra.
Charlie,
Yes.
can you point out the vertebral prominence for the cervical vertebrae? I'm looking off the list.
Okay. It's not going to show here.
Because it says it's not in the book.
Oh, I'll find it for you. I can tell you what it is.
Okay.
How did that get spelled? Prominence.
Prominens.
have to ask you to spell it for me. Okay, well, that's okay. I'm going to pick one that you ever go Googling and you can't find what you want? Okay, this is a good one. Here are the 7 cervical vertebrae. 1, 2, 3, 4, 5, 6, 7. Okay. Now, the spinous processes stick out quite some distance, but in number 7, it's the longest. Feel at the back of your neck, start at your occipital bone, go down your neck, and you'll find a bump. You've seen it all your life. There's a bump there before the thoracic vertebra start. Find it?
Mhm.
Okay, that bump is the location of the vertebral prominence. Vertebral prominence is another name for C7.
So it's only on C7 because it's the longest.
It's C7.
prominence?
Just
Okay.
like the axis is C2 and the atlas is C1, the vertebral prominence is C7. The others don't have nicknames. Okay. It's so big as a bump in the back of your neck because of all the connective tissue that's adhering to it, okay, and its size. Okay, so essentially, remember we did the external occipital prominence or protuberance
Mhm.
at the back of your skull.
Mhm.
We've given this one a name too, the vertebral prominence.
Now, would that be specified if it would say what is it called C7, or would you have to know it by visual? If one was like longer or shorter, you would identify it.
That's a question that I would probably include if let's assume I'm going to use that question. I would include it in the text questions.
Okay, not
Uh,
necessarily visually.
no, 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 no. And certainly if I did have it visually, you would have the whole string of vertebrae and you can count yourself.
Okay.
Okay. I would never have them separated apart like this picture that's in front of us right now.
You can't tell based off of, you don't have anything to compare it to.
Right. Exactly the reason. Now, with the lumbar vertebra, if I'm ready to go on, if you are,
Yes, thank you.
okay, this is the biggest. These 5 are the largest. They make attachments to the muscles of the legs primarily and of the trunk. This is a profile view. The whole is artificial to string these together. This is the body. This is the superior articular process, the inferior articular process, and the spinous process. They're unremarkable, but we can't do without them. Here's the sacrum.
Charlie, before you move on from lumbar process, how many
Sure.
did you say were present again?
Say what?
How many of those are present in our bodies again?
5 of them. 5.
Thank you.
In the sacral vertebra, this is the posterior view. We'll have the anterior next, but this is looking at it from the back. Across the top, where I'm going back and forth, this is the base. This star also indicates a point on the base, but it's not the only part of it. You see that this is triangular, and this wider portion here is the base. Okay. This is the apex down here. Why is it this the apex? Because I'm trying to show you the sacral vertebra, and this is the coccygeal or coccyx down here. This is the base. The sacral canal. We had the spinal canal, running through the vertebral foramina, all lined up. When they hit the sacrum, they go through, the spinal cord goes through, or can. I'm going to clarify that in a second. The nerves of the spinal cord go through, and they come out all these holes. And part of it comes out at the other end. This is the sacral hiatus. Another word for hiatus could be exit. Now, the reason I took back saying that the spinal cord goes through here, the spinal cord doesn't reach this far. The spinal cord itself goes down through those sacral foramina that we talked about. Vertebral foramina through L2. The spinal cord only goes down to L2. But then at the end of the spinal cord, it sort of spreads. It spreads or shreds, and nerves continue down. Okay, spinal nerves coming out these holes, but no cord is in here. Okay. The holes are called the posterior sacral foramina. There are usually 4 pairs between 5 sacral regions. 1, 2, 3, 4, 5. The sacrum is believed, and in fact it's known to have been formed from 5 bones, but they fuse together so perfectly we consider them to be only 1 bone in maturity. So this is the sacrum, 1 bone.
Where
The
is
coccyx,
the 5th foramina? Is that the apex underneath the star, or is it
at the star.
at the star? Okay, thank you.
Okay. The coccyx, we really don't have a lot to say about that. It does have 1 spinal nerve, but we're not ready for spinal nerves yet. Now we're going to flip this around. This is not anatomical view. Anatomical view that we talked about is to look at somebody from the front. And this is what we would see. The sacral promontory is at the very top, and it juts into the pelvic cavity. If it juts in too far, it's going to be awfully difficult for a child to be born. And measuring this in a potential mother may be important enough to even have a x-ray that includes the fetus, as I mentioned earlier. If it's too bad and would result in injury to either the mother or the child, well, then you would probably have a C-section. That would be the choice for the person that wanted the child anyway. Well, what about the front, these holes? These are the anterior sacral foramina. And you see there are still 8 of them, 4 pairs. Why do they name the hole one thing on one side, anterior, and posterior on the other side? Because how many holes are there? There's 16. 8 on the back and a plate containing 8 holes on the front. When this bone forms, the plates overlap, the holes overlap. But each one of these is 2 holes, one on the anterior side and one on the posterior side. Okay. Okay, here's the posterior view. This is the mid-sacral crest right here. Now, I didn't see that up here. I missed it. Mid-sacral crest. Okay. Running from the base down the midline of the posterior side. the mid-sacral crest. What I want to do now is turn this one. This is being revolved. This is going away from you, this part away. This is coming to you, so that when you turn it to your left, it looks like this. The entire spinal bones, the vertebral bones, make a curving pattern. They're not straight. It gives a lot more strength and flexibility to be curved. On the lateral side, we want to see this. Okay. Now they're showing this and this as being the same. They are by name. They're the auricular surface, not articular. Articular means joint. Auricular with a U means the shape of an ear. Not my ear, but somebody's ear might look like that. This one is really this one. Doesn't matter. Doesn't matter. They're both auricular surfaces.
Charlie,
Yes.
to differentiate between the anterior and posterior side, would you just look for the mid-sacral crest or the
That's
base?
one way.
Okay.
It absolutely is a one way, very legitimate way.
Okay. What's the other way?
The curve,
The curve? Okay.
it's concave on the anterior side and it's convex on the posterior side.
Okay, thank you.
Okay, now we're going to be looking at the ribs and the sternum, and figures 724 and 725 do the best for you. I'm going to do the rib last. It's coming up. Your breastbone is broken into different parts. First, the main part, like if you were a gorilla beating your chest, okay, right in the middle. This is the body of the sternum. You do need to know the word sternum, of course. Here's the body. Put your finger, a finger, right in the middle of your throat, in that notch, just where you might imagine a tracheotomy would be performed. Put it right in the notch that I'm showing you right here. And that's the jugular notch. That one doesn't have a label. Here it is here. This is the jugular notch. Off to either side of the jugular notch are the clavicular notches where the clavicles fit in. Now let me show you up here. Does not have the clavicles. Here's the jugular notch. Here's the clavicular notch. Why doesn't it have the clavicle? Because right now you and I have been looking at the axial skeleton, and that's part of the appendicular skeleton. Rather than have me forget it and wake up in the middle of the night, if you've got that piece of paper, I told you yesterday that the number of bones in the body is 206 normally. There are 80 axial bones. The axial skeleton has 80 bones. Those are the ones that we're finishing right now. The skull, the sternum, the ribs to come, but what we're finishing right now is the 80 bones of the axial skeleton. The appendicular skeleton, which we are not yet at, but will be tomorrow. The appendicular skeleton has 126 bones. Don't worry, it's not harder, it's actually easier. And the total number of 80 and 126 gives us the 206. Okay. The upper part of the
Charlie,
yes,
so the bone labeled number 1, that is not the clavicle?
that's rib 1.
That's rib 1. Okay.
Your first rib is actually up in your throat in part. I know it's hard to believe it, but when you see a articulated skeleton, you will. We'll have one for you. Okay, this is the manubrium. Looks like a shield or a badge. Sticking in the sides of the manubrium are the first ribs. This is costal cartilage. Costal cartilage. I'm going to show you that in just a second, so you'll get it twice. You don't have to write it down right now. Then, where the manubrium and the body come together, the second rib attaches with costal cartilage. On the side of the sternum, the third rib, the fourth rib, the fifth rib, the sixth rib, and the seventh rib attaches, all to the sternum. And notches called costal notches. What's a costal notch? Well, imagine pulling a tooth and leaving an indentation, leaving a hole temporarily when you pull the tooth. If I were to pull these costal cartilages out, it will leave depressions where I pull them out. Those are costal notches.
Charlie, we don't need to know the name of the space where the manubrium and
No,
the
no, that's the sternal angle. No, you don't.
Okay, thank you.
Okay. If you're doing open heart surgery, you need to know that. Okay, let's go down, skipping the rib still. Let's go back to this. Here was the manubrium, jugular notch, flanked by 2 clavicular notches. Here's where the first costal notch is here. The second is in here. And the others, you can see them going down. Yeah. Sternal angle is on this sheet, but it is not on the sheet that I've asked you to copy for yourself. It doesn't hurt to learn it. I mean, you won't do yourself any harm. But if you want to cut down a couple of things that you don't need to focus on, then you want the sheet. Okay. At the very end of the sternum is a part that is still part of the sternum. This is the xiphoid process. You felt this yourself, I'm sure. You can feel it right now. Pushes in fairly easily. It's mostly cartilage, not bone. In doing CPR, they teach you to keep away from this spot right here because you can break it off. Breaking off the xiphoid process isn't life-threatening, but it separates the abdominal rectus abdominis, abdominal muscle, from the sternum. That's not going to be comfortable for a long time. Okay, now we go up to the rib. You're not seeing the entire rib, but I think you can imagine that. Okay, the rib makes sort of a candy cane hook This particular rib is a left rib, and it's going to touch the thoracic vertebra in two places. One at the head, then it condenses a bit, gets smaller. We call this the neck. And then the tubercle, head, neck, tubercle. Got to remember those. Sort of like Malus, Icus, and Stapes. Head, neck, tubercle. The tubercle articulates at the end of the transverse process of the thoracic vertebra. The body or shaft now curves completely around. You can call it either. And on the underside is a groove, a thinner portion. Our particular interest in the groove is to put it on the underside so that we know we have the right orientation. Otherwise, if I flip this over, I'm going to think I've got a right rib, and I don't. Okay. Now you really want to remember this head, neck, tubercle, because tomorrow on the radius, it's going to go head, neck, tuberosity. There's a difference between the rib and the radius. For today, head, neck, tubercle. Now, on my sheet, under ribs, you may be reading this along with me for 725 and 724. I had head, neck, tubercle, we just did. The body, we just did it. The groove, we just did it. The costal cartilage, didn't do that. It's at the end and it doesn't show here. I don't like that question anyway, because this is costal cartilage here. All this, what color is this? Gray? No.
It's like a blue, a light blue.
Okay. Yes, then with this light blue area is costal cartilage. Okay. Now, the true ribs. One of the questions I would always ask, and it was on the very first test that I ever gave in anatomy. It was the bone test. In those days, students had so many seconds and minutes to answer the question, then they had to move on. We don't have to play that game. But the one guy came up to me after I put the scores out, and he said, his name was Abe Sanchez. I remember him so well. He said, that was the toughest test I ever took in my entire life. And I said, it wasn't for most of the people in here. They scored very well. What was your score? I knew what the answer was. His score out of 100 was 4. 4. Well, I didn't have much hope for him completing the course, but he wanted to talk about one question in particular he didn't understand. And that was the question that I asked about how many ribs, pairs of ribs are there? Or how many ribs total are there? How many ribs total are there? Anyone?
How many did you say?
How many ribs are there? Just look at the picture, starting at rib
24.
24.
Right. 12 on this side, 12 on that side. And the answer is 24. Plus, I'd already told everybody that in lecture, 24 ribs. And he said, no, it can't be the answer. And I said, well, what is the answer then? 23. And I know where this is going. And he says, God took one of Adam's ribs to make Eve. So Adam had only 23 ribs. Got to be 23. I convinced him, however, and I said, if your father had lost a finger, would you be born without a finger? And he goes, no. And I said, that's because the DNA is still there. It got all the information. So let's assume, because I didn't want to argue religion with him, that God took one of Adam's ribs. Does that mean Adam's children have 23 ribs? And he realized, no, the answer's 24. So Abe said he would do better on the next test. I've heard that so many times. Do well on every test, and that's the way to work it. But the next test, the practicum, was on the muscles. That's considered the toughest. And in those days, it was put together in a rather tough manner. Abe's score on the muscles and the functions of the muscles, 100%. And nobody else in the class got 100%. So I couldn't say or worry that he cheated or anything. He never missed another question for the entire class. So I looked at his score at the end. He was 2 points shy of an A. Can you believe that after a 4 on the first one? So I looked over his papers and I concocted 2 points for him somehow. I wonder what he's doing these days. Okay, now the first 7 pairs of ribs, that's 14 ribs, are the true ribs. Why do we call these first 7 true? Because they have their own costal connection to the sternum. Here, number 2, number 3, number 4, number 5, number 6, and it also, yes, blends here a bit, but it has its own 6 and 7. Those are the true ribs. The false ribs are ribs numbers 8, 9, and 10 because they piggyback a ride on number 7. They don't have their own connection. I think that's rather a minuscule point, but it's always pointed out in all of the books. Okay. We don't have enough room for 3 more connections on the sternum. So these 3 piggyback. And then we have another type of false rib, numbers 11 and 12, which also are known additionally as floating ribs because they have no connection whatsoever. Sometimes they can be pretty large and sometimes they can just be little nubs. But these down here are the floating ribs. Floating ribs, there are 4 floating ribs. They are also false ribs. The total number of false ribs is number 8, 9, 10, 11, 12. That's 5. 5 on the other side. That's 10. There's 10 false ribs, of which 4 are floating ribs. Somebody always comes up with, I heard Cher had her floating ribs removed to reduce her waistline. The truth is, it is done, but she never had it done. Okay. I don't know anybody who would want that.
Wait, Charlie?
Yes.
So if you were to get that operation done, what kind of negative side effects would that have on you?
The negative side effect is, in my opinion, is minuscule compared to your warped sense of values in the first place. Okay, I'm saying you're already mentally disqualified as far as I'm concerned. So I don't know that it has any negative effect. Okay, now you can do the reading. I'm not interested in that or people who want to have it done. I'm not interested too much and a lot of types of plastic surgery, as it's often called, when there are people who need real surgery, and not just cleft palates. We see that on television all the time, but burn victims and such who definitely need help. And you got a qualified person that could really help out, and they're at the cash register in their office in Beverly Hills. I can't stand that at all. Okay, one part of our profession anyway that I don't like. Okay, I'll back off from that. Any questions? Okay, now you get through tomorrow, and I promise you it's going to feel a lot easier. Every day seems to go a lot faster. If you have any questions and want to ask them personally, then you can just hang around. You'll either wait until it's just you and me, or talk in front of maybe one or two people, and or we can ask somebody to mute and stop their video. Okay, so no questions?
I have a question.
Good.
Since these are from chapter 7, should I read that and do an outline for that one as well?
Oh, no, I do not want you to outline the bone chapters.
Okay.
There's actually 2 or 3 bone chapters. I feel that we're going through it as we look at these pictures and everything, almost page by page, item by item. And no, I don't need you to do that. I think it will not improve your score. If I'm expecting you to get a 98% on the practicum, why do I need you to outline a chapter that has those 98 points in it? I don't. Okay.
So just 1, 9, and 2 for this week.
I wish I'd have said 1, 9, and 6. I may give you your choice. Okay. So right now it's 1, 9, and 2. When I change it or look at it tonight, okay, if I change it, I won't change it from 1, 9, and 2. That may mess up somebody, but I may make it 1, 9 optional 6 or 2. Does that make sense?
Yes.
Yeah.
Yes.
I think 6 is going to be a more important chapter to you. Okay, so if you haven't done 2 yet, you're free to go ahead and do 6 instead, and not worry that you're not doing the right thing. Okay.
Are you going to tell us tomorrow? Oh, sorry.
I will change it on the module.
Are you going to tell us tomorrow which parts of chapter 2 or 6 to outline, like you did for chapters 1 and 9, how you omitted some things?
Always do that. I always do that. Okay.
All right. Thank you.
Okay.
Charlie, I have a
Yeah.
question. So everything for the first lab practicum is on the week 1 module, or is there stuff to follow?
It's all there.
All right, thank you so much.
There'll be practice quizzes coming still for the weekend that you can work on, and even part of a practice test. These multiple choice text questions of the first test are not indicative of the type of question you're going to get on the practical. They're indicative of the type of questions you get on the lecture test. I want to put together a couple pages of practicum questions for you. Okay, so that actually I think you'll calm down if you're not already. Okay. Okay, well, if you're going to leave, have a good evening. If you want to stay for a moment and talk, I'm going to wait here. Okay.
Thank you.
Bye-bye.
Thank you.
Thank
Bye.
you.
Thank you, Professor. Thank you.
Charlie?
Thank you.
Yep.
So for the practicum that's coming next week, is that going to be all multiple choice?
Yes, it is.
All right. And as you said, I remember you mentioned how there was a professor previously that you knew that mixed up these words, so it was pretty confusing.
I don't do that.
Yeah. Okay. Cool.
No, it's a fair test.
Yeah. Sweet. Thank you.
Bye, Mike.
Charlie, I'm not sure if it's just me, but I am having difficulty opening the web links for Unit 1 in on the website.
I just did it, so I don't know why.
I was having the same issue, but I went on Safari instead of Chrome, and it worked. I don't know if you have that option.
I'll try that.
Yeah, I use Firefox. I know they say use Chrome, but it's a little too weak as far as I'm concerned. Give it a shot, okay? If you can't get it open, either let's see for the give me an email that you can't get it open. I'll see if I can figure another way around. I know I can open it. I just did. No.
Right, I noticed.
Okay, so.
Thank you.
Okay.
So for the practicum, basically everything that's here on these pages, that's what we're gonna need to label, right? Basically, this is it.
You got it. You got it perfect.
Cool. And then, so I ordered some of the stuff on Amazon, but the words are a little bit different. Like, for example, inferior orbital fissure. Would that be the same thing? Like, I know it's multiple choice, but that's the exact same thing.
Well, inferior orbital fissure is the name I use too.
Oh, I thought I saw
you got to pick
different.
something else.
Where was it? I saw something different here that you mentioned. Okay, maybe I have to go back.
Okay.
But
have you spent a lot of money on Amazon?
No, it's just that I got these a few weeks ago. It's not like they're pretty reasonable, but it's just something that I can see all the time.
Couldn't wait to get a head start. Okay, I know that. But I would suggest that you don't need to buy anything else for the course. Everything that you'll need, I'll provide. But it can't stop you.
Yeah, no, I was just really nervous about this class. Cool. Well, thank you.
Okay. Goodbye, John. Okay, there's two of you left. Do you have a private type question, anybody? No?
No, don't mind Taryn and I. You can hang up. We just sit around for the very last question, just in case something important that we hadn't thought of comes up.
If you're sitting around for the very last question, it's got to come from one of you two.
Taryn, you got anything?
I can't hear you. You're muted.
I don't have any questions, but Charlie, Randy and I came from the same chemistry class last semester with Dr. Petka, and we did the same thing.
Okay. Whatever works. Whatever
Thank
works.
you.
Thank you.
Okay, bye-bye.
Bye.